Sulphur. The common names of the sulphur are brimstone and flowers of sulphur. It is proved by Dr. Samuel Hahnemann. Introduction. Sulphur is one of the greatest polycrust remedy and is a king of antisoric. A homeopathic sulphur drug is prepared by two ways. First one, flowers of sulphur are washed and mixed with alcohol to form tincture. The second process is by triturating the flowers of sulphur with sugar of milk. Sphere of action. Its action is centrifugal, that is, from within outwards. It has great affinity for skin. It acts on nervous system, mucous membrane, venous capillary system, and portal system. Constitution. Sulphur patients have dirty, filthy look of the body and prone to skin affection. This type of people have redness of all external orifices. Examples: nostrils, lips, anus, etc. Sulphur is especially suited to lean, stoop-shouldered person who walk and sit in stooping. Standing is the worst position for the sulphur patient. He always seeks support for standing. Sulphur patients have nervous temperament. They are hot patients who cannot bear hot weather, or all complaints are aggravated at hot weather condition. It belongs to Scrophilus diathesis. Sulphur is the king of antisoric remedies. Guiding symptoms. In sulphur patient, complaints are continuously relapsing. There is a congestion in single part. All the discharges are acrid and offensive. Example, leukorrhea. Sulphur facilitates absorption of serous or inflammatory exudates in pleura, joints, when the best selected remedy fails. When carefully selected remedy fails to produce its effect, then sulphur rose the reactive power of the system and clears up the case, especially in acute diseases. So, when well selected remedy fails, sulphur is the most indicated drug. Burning. Wherever there is a sulphur complaint, you will find burning. Burning sensation of skin, glands, stomach, lungs, bowels, rectum while passing the urine. Burning of soles, feet, palm of the hand, top of the neck, etc. So, burning is anywhere and everywhere on the body. Burning aggravates from warmth of the bed and covering. Sulfur, arsenic, and phosphorus are trio of burners. Aggravation by heat is another keynote symptom of the sulfur, especially by the warmth of the bed. Though sulfur is a hot patient, yet they refuses to take bath. Sulfur should be thought first when the patient comes with the history of suppression of skin diseases by external application. Mind of sulfur. Ragged philosopher. Even rags seem beautiful when the patient take a fancy for it. He dress himself in the most filthy rags. He become a false philosopher. The more he goes on this stage, the more he disappointed, because the world does not consider him as the greatest man on the earth. Paper crown. The patient wears a paper crown and thinks he is the king. There is a great weakness of memory, cannot find proper word during the conversation. He is very selfish and has no regard for others. Happy dreams wake him up singing at the night. There is a feeling of movement in abdomen as of child. Ailments from alcohol, suppression of skin diseases, sun's heat, overexertion, etc. GIT. Weak, empty, all gone feeling in the abdomen at 11 am. Great desire for sweets. Sulfur is aversion for milk and meat. There is a movement in abdomen as of a fetus is felt by the patient. Constipation. Stool is very much hard, knotty, dry, as if burned, large and painful. Constipation alternates with diarrhea. Piles. Piles are painful, blind or bleeding, itching and burning in the anus. Anus is red and sore. Diarrhea. Early morning diarrhea, drying out of the bed early in the morning as there is a lack of sphincter ani. Involuntary and painless diarrhea. The character of the stool is brown, watery fecal, contain undigested food particles with offensive odor. Tongue. Tongue is white coated with red tip at edges. Respiratory system. Nose. Profuse scatteral discharge from the nostrils, freckles and black spots on the nose and face. Nose bleed readily and is swollen. Redness of outlet of nasal cavity. Laryngitis. Hoarseness worse in the morning. More chronic the case, the better is sulfur indicated. Bronchitis. Oppression of chest with feeling of hoarseness. Patient feels suffocated and wants the doors and windows open, especially at night. Sharp stitching pain through the left lung to back and aggravated by least motion. Pneumonia. Causes of pneumonia are suppression of skin diseases. In pneumonia, upper left lobe of the lung is affected in sulfur patient. Chest feel heavy and burning sensation. Loose cough with rattling of mucus is seen. Greenish expectoration is seen in pneumonia. Stitching pain in chest shooting through back. Dyspnea in middle of the night with difficulty respiration and wants the windows open. Female genital organs. Menses. Sulfur is indicated in dysmenorrhea and menorrhagia. Menses are too late, short, scanty, and sometimes profuse. Character of blood is black, thick, dark, acrid. It is associated with fullness with bearing down in pelvis towards genitals. Menses is preceded by headache if suddenly stopped. Skin. It is indicated in all sorts of skin eruptions, vesicular, pustulars, etc., especially treated by the medicated soaps and medicated washes suppressed by ointments. Dirty, filthy look of the skin with filthy odor is seen in sulfur patient. Every little injury suppurates in sulfur. Patient does not like to be washed or bathed. Itching in bends of the joint and between the fingernails. There are boils and abscess, especially in the summer season. Sulfur baby. Sulfur babies are soric scrophilus who are emaciated and pot-bellied. They cannot bear to be washed or bathed. There is early morning diarrhea, which is painless and involuntary and acrid, causes redness of anal orifices. They prone to have worm infestations with intense craving for sweets. Child cries before stools. General modalities. Aggravation. Standing, rest, warmth of bed, washing, bathing, alcohol, changeable weather. Amelioration is by dry warm weather and lying on right side.